Auzubillahiminash-shaytanir-rajeem. Bismillahir-rahmanir-rahim. Hello everyone. I am again here with a new topic, and it is a topic for interest of many people. Relatively a unique topic, and today I will talk about refractive surgery of the eye. What does refractive surgery mean? Refractive surgery means that if someone wants to get rid of his or her glasses, then we perform a special sort of surgery which is based on laser, and within 5 to 10 minutes painless procedure, the person becomes uh, quite okay, and he can see 6 by 6 just after 10 minutes of the procedure. So I get many questions about the prerequisites of refractive surgery, about the procedure, and what are the post-op uh, complications the people fear. So I will talk on these three uh, domains in this small video. I don't want to make videos long so that you don't become bored. First of all, the refractive surgery is done only for myopic patients, that is, people who have minus number. Secondly, it can be done for as much as 10 to 12 diopter spherical number and up to 4 diopters of cylindrical number. In simple language, if you have 10 minus 10 diopter of number of your glasses, you can go for refractive surgery and get rid of your glasses. Before that, we perform certain scans and of the cornea, and if everything is perfect, then we go for the procedure. Now I will go for one step forward, and I will tell you what are two main procedures which are performed these days. The first one is the most common and most uh, reliable, time tested with good results. It is called femtoLASIK, and femtoLASIK is a procedure in which what we do, I don't use whiteboards or these sort of gadgets for let people understand. I usually try to make people understand with my words, and I take the help of my hands, with which Allah has given me this privilege to perform the procedure. So the basic thing is that in myopia, what happens basically, what we do on the cornea. In myopic patients, the shape of the cornea is like this. Can you see? It means that it's more concave. In normal patients, the shape of the cornea is like this. So in refractive surgery, what we do, the more curved cornea is made more flatter cornea by two procedures. One is called LASIK and the other is called PRK. PRK stands for photorefractive keratectomy. And first of all, I will talk about LASIK procedure. Patient comes in the clinic. There are no prerequisites of any sort of blood tests or things like that. We perform our eye test in our eye clinic, which are just like you are getting your eyesight check on the auto app, totally painless. We take your VN again. After having done this, we shift you to the laser room, where a specially highly sophisticated machine is placed, and we ask you to lie down on the machine. You simply have to see on the right dot on the machine. And what we do in Lasik, for example, this is the cornea, okay, and cornea has 5 layers. Medical students may be knowing, but for general population who don't know, cornea is the outermost cornea is the outermost layer of the human eye, which is transparent. What we see, the color of the eye, that is brown, or in English people it is usually gray, or in our northern areas, or in anyone, someone can have gray color of the eye. That is actually the color of the iris, not the cornea. We see the iris through the transparent cornea. So what we see, brown color, it is iris, which we are visualizing through the transparent cornea. So you can, for general understanding, you can say that like a watch, like a wristwatch, you see the time and the clocks and the other things which you see in the watch, like whatever numbers and other things. You can say these are iris, and the glass or lens through which you are looking on these numbers, you can compare it with the cornea, because the lens or the glass over the wristwatch or any watch is transparent. If it becomes opaque, you will not be able to see behind. Similarly, if cornea becomes opaque, you will not be able to see behind the cornea, and neither you would be able to see the iris or the pupil or anything behind the cornea. So cornea should be transparent, and if you are looking through the glasses, it means your cornea is transparent, and in that almost 100% of the cases it is transparent if no disease is present. So I come back to the step. This is the cornea. In LASIK, what we do with the special knife, which is called microkeratome. First of all, we instill topical anesthetic, but that is just an eye drop which anesthetizes the eye and nothing else. No injection, nothing. That will anesthetize the eye. And a special microkeratome, which is not visible with the naked eye, and it is totally machine controlled. With the help of that, we lift a circular flap of the epithelium of the cornea, and the outermost portion of the cornea, like you can say this. We have, with the help of keratome, made a flap. The next step is the stroma, which is behind the epithelium. At the bed of the stroma, we apply excimer laser. It is a special type of laser which ablates the shape of the cornea, that is, it makes the curved cornea to the flat. With the special procedure, I will not go in detail. Video is already has become almost 10 minutes. So we apply laser according to our calculations which we have done before the procedure. Having done that, the flap which we had made, we just replace it on the stroma. That is it. you are done. We do the same thing with the second eye. One eye takes almost 5 minutes, two eyes take 10 minutes. After 10 minutes, when you come out of the laser room or operation room, usually you can see almost clearly and very clearly after a couple of hours in LASIK. So this is the procedure of refractive surgery. The second procedure is called PRK, that is photorefractive keratectomy. It is relatively an old procedure but still very effective and less expensive than femtolacid. So people who and equally with equally good results, but the only drawback is that it is a little painful, not painless. Similarly, if you have got, for example, -5, -6 number, we bring go in the operation or laser room. We instill the topical anesthesia, anesthetic eye drop in your eye. In this case, instead of making the flap, what we do, for example, this is the curved eye. We, in simple language, the laser machine will, it will do, it will start working, and the word which medically we use is called ablation. We ablate the cornea, that is, it starts working, a sound comes and it ablates it. Before that, sometimes we remove the epithelium, sometimes we do not remove the epithelium, and the procedure in which we do not improve the epithelium, we call it epithelial transepithelial PRK. So the basic principle is that the laser works here. You can say उर्दू में जिस तरह इसको रेगमार बोलते हैं or something like that, which reshapes your cornea. It is like this. It will act like this. I am telling you in crude word for awareness of the general population. And it will do it, we will do it according to our calculations which we have before, and we will see that the cornea is now becoming starting straight. And now machine has told us, it has nothing to do with the surgeon. Machine has told us now the cornea has come from this steepness to this steepness. Here we are automatically stopped by the machine stops working automatically, and after that we place a transparent contact lens over the eye and we give the appropriate medicines. The only drawback of this procedure as compared to LASIK is it's a little painful, not during the procedure. During the procedure it is perfectly painless like the LASIK, but afterwards when the effect of anesthesia vanishes away, then it may cause irritation, a small sort of pain, redness for 1 or 2 weeks. After that it resolves, and after 1 week we ask the patient to come for the follow-up and we take out the lens. In LASIK the follow-up is also not required even. So the video is almost 14 minutes. I wanted to make it short, but I feel that it was not possible to make it shorter than 15 minutes because I tried my best to explain both the procedures. The first is the LASIK and the second one is the PRK. So hope to see you again with some new topic. For any questions on this topic or any other topic, please comment in this video comment box, or see my channels about information. You can contact me via email, Twitter, WhatsApp and Facebook, etc. So thank you very much for watching this video, and Hope to see you again soon. Take care.